Hello friends, today we will discuss about strains which is used in microbiology. Okay, so I'll be covering all these strains which have been asked repeatedly in the examinations too. So I'm sure one questions will come from this topic, either in clinical questions, or either it can be a direct questions, or it can be a image based questions. Okay, but one question from the strain will be coming, that's for sure. So okay, let's start. So first, you want to know what's a simple strain. Okay, so as the name implies, we'll be using only one strain. Okay, so these are the primary dyes like methylene blue and basic fusion. Okay, so we won't be use any other dyes, only one dye we'll be using for the simple strain. Okay, so next it is a negative strain. So negative strain is example will be India ink strain and the nigrosan strain, and this is mainly for the capsule demonstration. Okay, so how it will appear is the background will be very black, but the organism or the capsule it will be like transparent, or it will be like an fluorescent. Okay, so you want to know if they are asking about negative strain, it is mainly for capsule demonstration, and examples are India ink strain and the nigrosan strain. So coming for the third point, it is an impregnation method. Okay, so what is this impregnation method? It is nothing but you are impregnating. Okay, you are giving some material to make the strain better. So that is a silver salts. Okay, so normally very thin or very ultra thin structures which cannot be seen easily under the microscope. Okay, so at the time we will be adding some of the silver salts. Okay, so get to make the structure somewhat thickened, and so that we can easily seen under the microscope. So what are the structures like bacterial flagella and the spirochetes. Okay, and even the leptospiro also, spirochetes like Treponema pallidum and Treponema pallidum endemicum. So these are all the very thin structures, so we'll be adding in silver salts to make it more visible. Okay, so next it is a differential strain. So under differential strain you want to remember 3 points. So one is gram strain, acid fast strain and Albert strain. So first, I want you to know the basics. Okay, so gram strain, so we can differentiate whether the organism is gram positive or gram negative. Okay, so coming for acid fast strain, it is for it is whether the organism is acid fast or non-acid fast, and Albert strain is mainly for, yes, it's for the Corynebacterium diphtheriae, and that too for staining the metachromatic granules. So we will be dealing it in detail. So first, gram strain. So you want to name the discoverer, whose name is Hans Christian Gram. He discovered in 1884. Okay, so this year and not important, but just remember the name of the scientist who discovered the gram strain. If our time is back, we can get this type of questions too, we can say, right? So coming for procedure, so first it is in fixation. Okay, so how will you fix a smear? So just you will be taking a slide and just we will pass it over the Bunsen burner. So Bunsen burner, that is the flame. So just fix the smear. So second, we'll be using a primary strain. What are the primary strain we'll be using here is crystal violet, gentian violet and methyl violet. So we'll be so just remember, so we'll be taking a slide. Okay, and you are taking an organism culture and you are making it over a smear. So and you just pass it over the flame. So and then just keep it for air dry. So now we will be adding a primary strain, either it can be crystal, gentian or methyl, and you will be keep it for 1 minute. Okay, so next step, it is just you will be wash the methyl violet. Next you will be adding a mordant, that is called as a gram iodine. Again leave it for 1 minute. So what happens here is this gram iodine will go and combine with the methyl violet. So next third step is decolorization, in which we'll be using acetone, ethanol or acetone alcohol. So the acetone for 2 seconds, ethanol for 20 to 30 seconds and acetone alcohol for 10 seconds. So but we'll be most commonly will be using in our lab is acetone. So 1 to 2 seconds, okay. So for exam you don't need to remember this seconds at all. So just remember only for the acetone and just remember the names enough. So just what will happen is, so you will be washing the grams iodine and just you will be pouring in acetone. You want to wash it immediately within the seconds. That is okay. This is a crucial step in the gram stain decolorization. And next you will be adding in counter stain, that is it can be safranin or dilute carbonyl fusion or neutral red. So neutral red is mainly for gonococci, and again this is in previous year question. Neutral red it is for the gonococci, and again here time is 1 minute. So everything here is 1 minute except the decolorization, which is for about 1 to 2 seconds. So now what happens is, so the gram positive organisms usually appears in violet color and gram negative will be appearing pink color. So coming for principles of gram stain. So one, it is in pH theory, that is the cytoplasm of the gram positive bacteria, it is usually acidic, okay. So it will be combining with a basic dye. So it's called a pH theory. And second, it is in cell wall theory, okay. And this is important. So what happens is, just we will recall the gram staining steps. So first we'll be adding a primary dye, that is in methyl violet. So at that time what happens is, both these gram positive or the gram negative, it will be taking the primary stain, that is in methyl violet. So second step we will be adding a mordant again, that is a gram iodine. So again these two bacteria, what will happen is they will be taking grams iodine and they will be forming a complex, that is in methyl violet and the iodine complex. So the third step is, what is that acetone we will be adding for decolorization. So at the time what happens is, so this gram positive it will be having, because of thick peptidoglycan and there is no lipopolysaccharide, it won't allow this complexes to come out of the cell wall. Whereas the gram negative will be having a thin peptidoglycan and lipopolysaccharide will be there. Because of this, acid will be adding this lipid solvents will be get, sorry, what is it? It will be so there will be pores in the lipopolysaccharide. It will become larger and it will allow the diiodine complex to come out. So what happens at this stage also, the gram positive will be violet in color, whereas gram negative will be colorless. So next step you will be adding a counter strain, that is an dilute carbonyl fusion. So the gram positive, as usual, already it has taken the strain and it won't take the further strain. But gram negative, as it is colorless and there is no proper peptidoglycan or no lipopolysaccharide, it will be taking the dye and it will become pink in color. Okay, so this is a basic. Just you remember there are two theories. One is cell wall theory, another is pH theory, and you want to know these steps. So first it is in methyl violet, second iodine, third decolorization is in acetone, and fourth it is in dilute carbonyl fusion. So again time. So 1 second, 1 minute, everything is 1 minute except acetone, it is for 1 to 2 seconds. So some of the modifications of gram strain, Koploff and Biermann, Jensen, Weigert, Preston. Just remember the name, that's enough. No need to need the procedures and all. Okay. So the procedure and all it is for the PG's level and no need to remember. So just remember these names enough. Okay. So now coming for uses of gram stain. So just remember first. So you can make a clue whether it belongs to an anaerobic organism. Next you can have a clue how to proceed with the biochemical test, because if it is a gram positive, you will be dealing with like catalase and coagulase. If it is a gram negative, you will be doing indole test. Okay, what is it? Indole citrate utilization test or the urease test. Okay, so C, it is for yeast, that is a candida or the cryptococcus. So you know it will be staining like oval yeast cells. You can see it clearly. And D4, you can differentiate between a gram-positive organism and the gram-negative. So the gram-positive appearing in violet, whereas gram-negative will be appearing in the pink in color. Next, you can start for empirical treatment. Okay. So if you on gram strain, see, I will be saying a scenario like in an emergency department, if the patient is having any suspecting meningitis and they want to start the treatment, so they can give the CSF. So we can do gram strain and we can make out so whether there is a gram positive or gram negative. So as you know, there is a separate drug panel for both the gram positive and gram negative. Okay, so the physician can have an idea how to deal with the patient, that is how to start the treatment and to proceed with. So A for anaerobic, B for biochemical, C for candida and crypto, D for differentiate the gram positive, gram negative, and E to start the empirical treatment, and F the fastidious organisms. Okay, so you can have the clue, like, because if there is an if you're suspecting a streptococcus, okay, so streptococcus pneumoniae, it will be having an lanceolate shape and it will be capsulated, right? So you can make out in gram strain. So you are dealing with a streptococcus, so it won't be growing in an ordinary incubator conditions. So you want to provide it a minimum anaerobic environment like candle jar, etc. Okay, so just we can have an idea so that we can proceed with the culture sample. Okay, so as it next, so these are the points you want to remember for the gram strain. And here modification, so only the name is enough. Okay, fine. So next is acid fasting. So here it was discovered by Paul Ehrlich and it was modified by Z. Nielsen. So here there is a two method. Okay, one is a hot and there is a cold method. So hot method, here the heating is required. Cold method, heating is not required. So here hot method, first primary strain will be adding a strong carbonyl fission. Okay, so just remember the procedure. Will be adding carbonyl fission and will be heating it strong carbonyl fission for 5 minutes, and you will be heating it until the fumes appear. And decolorization, here it is an important. You will be using 25% in a what is it, Z. Nielsen strain for Mycobacterium tuberculosis, whereas 5% for the Mycobacterium leprae. Okay, so here it is in 3 minutes, and then you will be adding a counter strain, that is a methylene blue, for 1 minute. Then wash it off and observe it under the oil immersion. So you will be seeing a long slender beaded red colored acid fast bacillus. Okay, so here carbonyl fusion, sulfuric acid and methylene blue. That's all. So the percentage here is important, that is in 25%. So coming for cold method, here heating does not required, and decolorization. So here you will be using an acid alcohol, and here it is in counter strain is malachite green. So just here the procedure is not that much needed, but you want to know the strains, that is in primary strains and the counter strain. So next it is an Albert strain. It is for to strain the metachromatic granules mainly for Corynebacterium diphtheriae, Corynebacterium xerosis and Gardnerella vaginalis. So these are the organisms which will be having the metachromatic granules, and here how it will appear, because the bacteria will be green colored bacilli, okay, like, and at the top you will be seeing a metachromatic granules, and which is usually somewhat bluish black in color. Okay, so if there is a gram positive cocci arranged in clusters, it is Staphylococcus. If it is chain, it is in Streptococcus. Lanceolate is for Streptococcus pneumoniae. Spectacle eyed bacteria shape, it is in spectacle is like spect. So clusters is like this, you know. Chains like this. So lanceolate is like this. Okay. So spectacle shape, it will be like somewhat like this. So tetrads, you know, it will be like a big, and it will be a somewhat larger than the what is that, Staphylococcus. And octate, it is in like a 8 chain. Okay. So next coming for gram negative cocci, here it is in lens shape. Lens shape, it is, you know, something like convex. So next here it is in kidney shaped. Okay. So So lens shaped, it is a meningococcus. Kidney shaped, it is a gonococcus. So coming for gram-positive bacilli, which is arranged in a bamboo stick appearance like this. If it is a bacillus anthracis, and if it is a chain, it is a streptobacillus. And you know Chinese letter arrangement, it is in Corynebacterium diphtheriae, and palisade pattern is like this. That is in diphtheroids, and branched and filamentous. You know, it is in actinomyces and nocardia. So if it is a gram-positive bacilli, and if you are coming across these points, you can make out the organism. So next, it is a gram-negative bacilli. So it will be pink in color. I told already, gram-positive, it is always violet. The gram-negative will be pink in color. Here, if it's a pleomorphic, that's there won't be any proper shape. It is a Haemophilus and Proteus. And thumbprint appearance, it's a Bordetella pertussis. Comma-shaped bacteria, it is in Vibrio cholerae. And if it is a curved, it's a Campylobacter or the Helicobacter. Spirally coiled, flexible, it is in Spirochetes like this. Okay. So, and then spirillum, this is the spiral friends. And bacteria that lack the cell wall, it is in mycoplasma. So these are some of the hints. Okay, you can make out the diagnosis. The most common, these are the fungal stains. Okay. So first, the potassium hydroxide. The potassium hydroxide will be adding. So it is mainly, you see, I will be taking a slide. Okay, and you will be keeping any sample. It can be nail sample, or it can be any skin biopsy samples or anything. Okay, whatever it can be, and you will be adding the sample, and then you will be adding an 10% KOH. So, but generally they will be what they will do in the lab is they will be taking a sample and they will keep it in a test tube with then KOH immersed. So what happens is it will digest all the keratin which is present in the nails and makes the hyphae to clearly visible under the microscope. Okay, so the main action of potassium hydroxide is to digest the keratin. So normally we'll be using 10% of the potassium hydroxide, but for the nail, since it's very thick, we'll be using up to 40%, and DMSO can be added. It is mainly for tissue digestion. So next, it is in glycerol. Okay, so glycerol 10% is mainly to prevent the drying of a specimen. Okay. Here you won't remember everything. Okay, so next is a per-iodic acid strip is for fungal stain, and GMS, that is in gomari methanamine stain. It is mainly both, it will be staining alive and the dead fungus. It mainly stains the polysaccharide of the cell wall. So next it's a musicarmin stain. It's a carmiophilic cell wall mainly for the Cryptococcus and the Rhinosporidium. So next it is in lactophenol cotton blue stain. Here the lactic acid is mainly for, you can make out the morphology of the fungus. Whereas a phenol, it is a disinfectant, and cotton blue, it will be staining the fungus. Okay, and then so that we can be see the all the hyphae, like it's a blue in color. I think you can remember the LPCBs of the aspergillus, everything will be blue color, right? It is because of this cotton blue, and again the glycerol action is mainly to prevent the drying of the dye. Okay, so here in this fungal strain, each and every point is very important, and you want to remember all the points. Okay, I'm sure. So one question will come from the strain. So I told already, it can be what like it can be whatever, like clinical based questions or image questions or direct questions. Okay, so just go through this training topic once. Thank you.